Evening, everybody. God bless you. We greet you tonight in the name of the Lord Jesus Christ, to the New Life family, to all of our friends, Facebook friends, Instagram friends, all of you that have come on tonight to be a part of this COVID-19 platform. Certainly, we thank God for this privilege and opportunity that we can come tonight and get some good information shared with us tonight. We have one with us tonight that is well qualified to help us tonight, and she's going to give us an opportunity to see what it's like to walk in her shoes as being on the front line every day and dealing with patients who have been tested positive for COVID-19. So I'm here tonight because as a pastor, I'm always concerned about, especially situations and seasons like this. We're dealing with this global pandemic, and it's sweeping through our land, and people are dying by the thousands. And as a pastor, I want to make sure that I can give all of the proper information to all of our members and all of the friends who have gathered here tonight. The scripture teaches us that because of lack of knowledge, God's people perish. And so tonight, we want to come tonight. Rachel is a very qualified young lady that I met some time ago, and she will introduce herself in a few minutes. But I'm grateful that she allowed us to take some of her time to come tonight and be a part of this platform. I'm concerned because this global pandemic has reached out and touched all of us in some way, shape, form, or fashion. Whether it has been someone in your immediate family, whether it has been a friend. I've actually had it on both sides, friends and family members, and pastoral friends who have died as well because of COVID-19. And so we're here tonight to just get a little bit more knowledge on what we hear daily on the news. And Rachel is going to give you pretty much an upshot view of being on the front line and seeing patients come in and seeing patients leave out in death just as quick as they come in. So what we want to do right now is take a few minutes to bow our heads and open up in prayer. And then I'm going to turn it over to Rachel, and she will come and she will introduce herself, and she will give us a view of what it's like to be on the front line. And then she will answer some questions that have already been sent to her. And we have our chat to the right of us. And those of you who did not get an opportunity, such as our friends and those who are watching tonight far and near, you can put your questions in the chat box and we will try to get as many answers as possible. So let us pray. Father, we thank you and we bless you tonight in the name of the Lord Jesus Christ. We thank you for this platform that you have given us for this time tonight. And as we come, we glorify you and we give you praise, honor, and thanksgiving. We thank you for all of the households who have gathered here tonight to be a part of this platform. We thank you for Sister Rachel, who have taken out of her busy schedule to come and share with us tonight. So God, we ask that all that we do and say tonight will be done decently in order. We ask that you would bless us and you would keep us, and that you will be glorified in all that we do. In Jesus' name we pray, amen. All right, so with no further ado, I'm going to turn this over to Rachel. Tiara, you can unmute her, and she will come and she will introduce herself, and then she will move as the Holy Spirit leads her. So I'm excited, as well as I know you are, about hearing her tonight. So let's do this.
All right. Thank you, Bishop Jones, for the opportunity to address the members of your congregation. I really appreciate this. And like you mentioned, the lack of knowledge is really something that we're seeing that is working towards the detriment of a lot of the patients that I'm caring for. So I'll start with a little introduction about myself. My name is Rachel Sherman. I am a board certified family nurse practitioner. I currently practice in Maryland, Virginia, and Washington, D.C. I'm licensed in all 3 states. My current specialty is palliative medicine and primary care. And it's important to understand the severity of the situation, especially from the palliative aspect. I am coming in on a lot of cases where the patient is not going to survive. And unfortunately, that's a lot of patients. So I did the bulk of my education in Washington, D.C. I got my bachelor's from Trinity Washington University in Washington, D.C. Did my master's online, and I'm currently in my doctorate program, full-time practicing at University of Maryland PG Hospital Center. And then I have my own private concierge primary care practice. So I've been given a lot of talks about COVID-19, and I'm just trying to open up my phone so I can give you the statistics. I always start my talk off with the statistics because I want everybody to really understand where we are with COVID as far as the United States. So as of about 9 minutes ago, the United States confirmed just shy of 430,000 cases of coronavirus or COVID-19. 23,000 have recovered, and we have seen 14,600 deaths as of 9 minutes ago. And that's a number that's changing by the minute. So in terms of what a day looks like for me, I usually get up and I do one thing first. I pray that I'm going to be safe and that I'm not going to lose another colleague, because I have lost colleagues to COVID-19. I've lost friends. I have friends that are in the ICU right now fighting for their lives. So that's my first thing, is to pray that when I walk out of my door, I'm going to come back home to my family the same way that I left them. And it's really important to understand that healthcare workers, we are scared, we are stretched thin, we are fearful, but we're still getting dressed and we're coming to work every day. Despite not having the equipment that we need to protect us, it is our job to protect the community. And we're doing that in the best way possible. So I finish my prayer, I get dressed, come to work, and I pray again in the parking lot, because it's different leaving out your doors. But when you hit the hospital and you see the ambulance is backed up, you see the parking lots full, you get even you start to worry a little bit more. I come in, and usually my daily census is about 16 new patients. And these are new patients that are diagnosed with coronavirus, and they have a really poor prognosis. So prognosis means their likelihood to survive coronavirus, COVID-19. And I will evaluate my list and try to get to the patients that have the severest symptoms. So shortness of breath or pain, or maybe they're intubated or they're imminently dying. And my role is both medical, but it's also emotional, because right now families are shut out of the hospitals. So the last time that they will have seen their loved one is when they left their home or came to the emergency room and they were pretty sick enough to be admitted. And this could be about a week that a person goes without speaking to or seeing their loved one, because they're intubated and they can't speak. Every phone call that we make, we hear sheer panic from that family member. What are you calling to tell me about my loved one that I have not talked to, that I have not seen? It is, it's soul shattering to experience that when you call a family member and they're fearful of the news that you may potentially be calling to deliver. So I rank my patients in order of how sick they are. And I go to see the sickest first. And these are my patients that are usually most likely to pass during the first couple hours of my shift. Between today and yesterday, I've had 4 patients pass away due to COVID-19. This is a very serious illness, and it's evolving every day. So my phone calls to families will be that your loved one is very sick, and I'm going to try to facilitate a way that you can be put on speakerphone so that they can hear you, that you can maybe potentially FaceTime with them so that you can see them. I prepare them that what you are going to see, your loved one is intubated and sedated. They may not respond, but we pray to God that they can still hear you. And some family members are okay with FaceTime and seeing their loved ones, and some family members are just okay with being able to speak to the patient. As a healthcare provider, I have to limit how close and how often I'm in a room. Most of these rooms are airborne precautions, and we're running out of those rooms, so most of them we're just keeping the door closed. So I get as close as I possibly can to the patient without compromising my own safety, and I will place the call on speakerphone. Sometimes we can get the ministry support. So my husband is a minister, and sometimes we can have a minister who can do a virtual communion or virtual prayer. We're not allowing anybody who does not need to be in the hospital, we're not allowing them in, and that includes ministers, because we have to protect them as well. So we figure out what's most important to the patient, what's most important to the family, and we try our best to carry that out in their final moments. Everything that I have trained for as a palliative nurse practitioner, this virus has taken away from me. There are two distinguishing parts of medicine that are unexplainable. The emotion that you have, and that's when you assist a person to bring life into this world, and when you are with a person when they leave this world. It is an unexplainable connection that you have to support a person who is making that transition, and it's heartbreaking as a clinician when my training has done everything to prepare me to help people transition, not alone, not scared, and not suffering, to now be told that the closest I can get to my patient is through a glass door, and that I cannot facilitate a patient's loved one being at their bedside when they die. And that is a very, very, very heavy burden to bear, because it goes against everything that I find to be morally right. But the morally right thing in this case to do is to do the greatest good for the greatest amount of people, and that is to protect people from this virus. So after my patients pass away, I get a lot of questions from the family, what do we do next? Will I be able to see them? Will I be able to have an open casket funeral? And unfortunately, the answer to that is no.
So one question before you go any further. Can you give us an idea of how quick some patients come in, maybe sick, but not really, really bad, and the time limit from that point to how quick it is that they leave out of this world?
So that varies, but I'll tell you my worst case scenario, and I'll tell you my best case scenario. My best case scenario is we have someone who is relatively healthy, and they come in and they're pretty sick, and we have to intubate them to protect their lungs. And we anticipate that we're going to intubate them for about 3 to 7 days. When we intubate someone, we sedate them so they are not aware of what's going on. We have to paralyze them so that they cannot, it's what we call bucking the vent. So we are essentially breathing for that person, and if they're not paralyzed, they can have involuntary movements because of the ventilator settings. So we paralyze them with the medication, and we sedate them so that they're not aware, and hopefully their lungs can recover. If their lungs cannot recover, they ultimately stay in that position. So I'd say 3 to 7 days is the best case scenario for someone that comes in really sick and they have to be intubated. The worst case scenario, I've had patients come in and we're looking at a matter of hours, that they come in, they cannot breathe. We put them on a ventilator. By the time we have started to work up everything that's going on with them, we find that they're in liver failure, that they're in kidney failure, that their lungs are damaged beyond the point of repair, that we're in multi-organ system failure, or that we are in ARDS, which is acute respiratory distress syndrome. And we can determine this by looking at x-rays of the lungs or CAT scans of the lungs to see just how much infiltration we have. So that can be a matter of hours from the time that a person comes into the emergency room to the time that they're admitted to the ICU to the time that they pass away. We have patients who come into the emergency room and they're actively being coded that we are trying to resuscitate them because they have had an event in the field because of COVID where their heart stopped. And a lot of times we are unsuccessful. It's about a less than 3% chance that we will be successful in resuscitating a person that is coded outside of the hospital because of COVID-19. So those are our best and worst case scenarios.
Okay.
So to talk about me addressing the family's concerns after they pass away. When a person passes away in the state of Maryland, and this may be different from state to state, I assume that most states are probably going to start following suit because we're going to have a lot of people passing away, and there's not a lot of information known about post-mortem after a person passes away, how this disease can continue to be spread. We know that the body continues to be contagious for some time, hours, maybe even days. Once a person passes away, they are placed into a body bag. That body bag is closed, and then they're placed into another body bag that is sealed. The family is not allowed to see their loved one again. The funeral home will come to the hospital. They will pick the body up, and it's one of two things that happen. It's a direct cremation where they go directly to the crematory, or it's a direct burial where they take them directly to the cemetery and they bury them. They do not embalm the bodies. The body bag is not opened after someone with COVID or suspected to have COVID. So even if they did not test positive or their results are not back yet, if they pass away, we suspect that they had COVID, we're going to follow the same guidelines. And this is to protect the masses, so to protect the funeral workers. This is to protect the family, that they can't come in and see them. I've unfortunately had a patient yesterday whose daughter worked in healthcare, and because she had enough of her own PPE, we were able to facilitate her coming in. And the moment she walked into the ICU, her mother died within seconds. So it was a blessing that she was able to at least see her mother, but she had to see her from 24 feet away through a glass door. So we do as much as we can to answer the questions that families have, because this is totally different from what we know when we have a loved one pass away. It is not the same routine. It's not calling the funeral home and getting the flowers and making programs. You just don't get much closure when a loved one dies from COVID. We also are working to connect loved ones with ministry support, and this has to be done virtually or over the phone. So it's almost impersonal to have someone call you and offer their condolences, but unfortunately we don't have a better alternative because we cannot risk spreading COVID to other people. For our patients that do not pass away, I'm doing a lot of symptom management. So because we know COVID attacks the lungs, a lot of my patients are very, very, very short of breath if they're not intubated, paralyzed, and sedated. So we have them on high flow oxygen. It's like your regular oxygen. It's a tube that goes around your nose. It's high flow to support them so we can keep their oxygen levels above a certain percentage. Because the one thing that COVID does is when it affects the lungs, it decreases the amount of oxygenation you have throughout your body. And we know that vital organs, they can't function well without good oxygen. That's your brain, your liver, your kidneys, everything that your body needs. It can't function without proper oxygen levels and the exchange of CO2 and oxygen. So we're trying to keep their oxygen levels up. People are very fatigued, so they're very tired. It's very hard to have a good conversation because they're so tired. They may say 3 words and they're very, very, very short of breath. Some of our older patients get very confused. They don't have the reserve to tolerate much drop in their oxygen level. They can get very confused. They can get very anxious. They can get very combative. And these are the patients that we have to manage anxiety with. So I think my screen is doing something funny here.
We can still see you.
Okay, good. All right, it said paused.
Yeah, we can still see you. So so let me ask you this before you get into the questions. How many colleagues have you lost due to this?
7 thus far. And I said this very early in because there were a lot of rumors about COVID-19. One rumor was that African Americans or Blacks did not get this virus, and actually we are leading the deaths for COVID. African Americans have a higher risk of dying from COVID. And we think that's more so because African Americans tend to be more likely to have congestive heart failure, diabetes, history of a stroke, history of a heart attack, obesity, hypertension. So that's why we're believing, we don't have a lot of data yet, but this is why we really believe that African Americans are leading death related to COVID. We initially thought that patients ages 60 to 65 and older were the most likely to develop severe illness. And while that's still true, we are seeing more and more and more young patients coming into our ICUs and coming into our hospitals and dying from COVID. In Maryland, we recently had a 27-year-old previously healthy female who contracted COVID working at Giant. She died from the virus. I've had 30-year-olds, I've had 40-year-olds with no previous medical history come in very sick from COVID and pass away.
And so that should say something to us, that it doesn't matter how healthy you are. When they tell you to stay in, they mean just that.
Yes, so this is my phrase is, this is an equal opportunity virus. It is not going to pick and choose who it's going to infect. It's not going to pick and choose who it's going to cause to become severely ill. At this point, everyone is at risk for contracting COVID, and anyone is at risk for developing severe illness. Now, we know it's more likely in people who have health issues, but then we do have this small population of patients where we have no explanation why they are as sick as they are and why they die from COVID.
What do you say to the person that says, oh, well, it won't happen to me?
You are sadly mistaken. That is probably the biggest mistake that you can make, to think that you are not likely to become a victim from COVID. As a healthcare worker, and I've said this jokingly, but I think my friends and family really know that I mean it. It is probably one of the biggest slaps in the face that I've ever experienced, to leave out of my house every day and to fight for the lives of my patients, and to see my friends and family not take this serious and treat this, as my governor said, like a spring break. Because not only are you putting yourself at risk, you're putting everybody else around you at risk. You're putting everybody else in your home at risk. I tell people, do not wait until it affects you personally to take this virus serious. Now is the time. A lot of people are like, the weather's becoming nicer, I want to have events. Well, if we keep at not listening to the recommendations and guidelines, we won't have a summer, we won't have a fall. We're going to be at this for a lot longer than what we're anticipating. Right now, we're anticipating about another 10 to 12 weeks of dealing with COVID. In the state of Maryland and Virginia, we haven't even seen the worst of the worst. It's coming. It's the surge. We haven't seen the worst. We are building up to it. But when it comes, it's going to be very unpleasant for a lot of people. It's going to be almost like cancer. Everybody knows someone who's been affected by cancer. Everybody knows someone who may have potentially, or who probably died from cancer. And this is going to be something that everyone's going to be affected by.
So how do they determine the next hotspot?
So we do, so epidemiology is tracking trends, right? So the US actually has a pretty robust epidemiological group. So that's from the CDC, the FDA, local, state, national, and even World Health Organizations. So we track, or we're looking at the curve. You're going to hear about a curve. So we have essentially looked at what happened in China and what happened in Italy, and we track their curve. So we have an area of the curve where it starts low, and that's when things are really picking up, and then it slowly starts to increase, and then you see this big spike. That's the surge, and you go steady with it for a little while, and then you start to see it come down. So for China, they've been at this for maybe four and a half months, right? And their curve came down, or started to come down somewhere around 3.5 months. Same with Italy, right? Korea, they were able to flatten their curve rather quickly. But we also have to take into account that sometimes these countries may not be the most honest in the information that they report. And there's no way to really account for that. So we in America compare their curve, so these other countries that were really hit hard with COVID, and we compare it with what we're seeing. So we can really track and see, based on how many numbers we're turning over in terms of positive patients, we're able to track and see and make a prediction as to when we're going to peak. So New York and New Jersey, they're in their peak. And if you can't see it on the news by now, COVID is tearing through New York and New Jersey. I mean, they're throwing up hospitals in Central Park to try to accommodate for what's happening. They're bringing in freezer trucks to try to accommodate the remains of people who have passed from COVID. In these areas like Washington, D.C., these suburban areas where we have a large population and less resources, these are the areas that are going to be hit really hard. Prince George's County, Maryland, has almost 1 million residents. We don't have enough hospitals or hospital beds to support what's going to happen with this surge if we see people still going out and still contracting it and still becoming gravely ill.
So pretty much based on what we have seen in Pennsylvania, New York, New Jersey, that's probably coming our way if we don't heed to staying in, or it's going to happen anyway, whether we stay in or not.
So it's going to happen anyway, whether we stay in or not, right? But the reason that we are seeing these stay home orders is because we're trying to decrease the amount of people who A, will contract it, and who B, will need to be in the hospital and have ICU level care. At this point, there's not much that we can do to stop what's coming our way. What we can do is try to decrease the magnitude of people who are going to be gravely ill or who are going to die from this. And that's why we're telling you to stay home, only go out when you really, really, really need essential resources.
So what do you tell a company like nursing homes or youth organizations where they still have youth coming in and out? What should they do at this particular time?
They need to shut down.
Okay.
They need to shut down. I'm a health advisor for one of the local cities here, and they have a senior center. A good portion of that city is made up of seniors. And I went into that facility maybe about two and a half weeks ago, and they still had their seniors meeting. And I told them, you guys need to shut this down immediately. This is a group of people that have the potential to get very sick from what we have going on. Anything that is not essential, it needs to be shut down. Maybe they need to find alternative ways to connect these young children and these seniors, but having them physically together is not a good idea.
So if they are essential, then what precautions should they take?
So essential, like nursing homes, right? These are essentially people's homes. They live there, whether it's for a temporary period of time or whether it's long-term care. They have specific recommendations for isolating and treating patients that are COVID positive. I don't know if you've seen on the news, there is a nursing home in Carroll County, Maryland, where just about every resident is now COVID positive because they did not heed recommendations. Imagine having your loved one in a nursing home and you get a call that they're COVID positive and everybody in the facility is COVID positive. You can't see them. They may get to a point where you can't talk to them. It may get to a point where they pass away and you are completely disconnected from your loved one. That's why it's very important that people understand when nursing homes are saying, I'm sorry, you can't visit your loved one at this time. I'm sorry, we can't take deliveries or packages at this time. It's not to be mean. It's not to completely shut you away from your loved one, but we have to be very careful with what we're bringing in. It's also important to know that if you're sick, so anybody on here that works in healthcare, or you have an essential job where you have to report to work, if you're sick, you do nobody any justice, including yourself, to go to work if you're sick. Stay home, isolate yourself, call your primary care doctor until you know for sure that you are not COVID positive. For other essential organizations, like school is essential, and they've essentially thrown up virtual learning in a matter of weeks. They've put together virtual learning. We have to get very inundative for these essential types of organizations. There are certain organizations that we can't close the doors on, and those are hospitals, grocery stores, things like that. But in the state of Maryland, if you're not essential, your business is closed.
Okay, all right. So some of the questions that were sent to you via email, can you get into some of those?
Sure.
And so everyone can get a chance to hear some of the questions that were sent in.
Great. And I think I see here, because I replied to them, and I think I see the PDF here as well.
Okay.
So if anybody has an additional question, for most of my answers, I've attached a resource. If you click the link, it'll take you to the website where I'm getting most of my resources, or at least I find will be beneficial for non-medical folks to understand how to protect themselves from COVID.
Rachel,
So,
before you get to that question,
sure.
before you get to those questions, can you do one thing for me? Can you speak to us real quick about fact-checking information?
Yes. So I know people have probably seen posts on Facebook, my cousins, brothers, sisters, uncle works for NASA, or works in the Pentagon, and they're saying that this is coming. That information, scroll past it. If anybody works at that high level and they're getting information like that, the last thing that they're going to do is report it to somebody so it ends up on Facebook. The government and even medical providers, I'm going to cut my light on here.
Okay.
The government and even medical providers, we have to be very careful with the type of information that we release to the public. It's not that we want to keep you in the dark, but we want to make sure you have accurate information, you get it in a timely manner, and that it's not going to be anything that's detrimental to your health. So when you're fact checking things, you're going to look for it to come from an official, legitimate organization. Johns Hopkins, CDC, the World Health Organization, other local hospitals, academic institutions. I'm all for freedom of the press, but even information that is released in the news, you have to fact check it, because we know the media can report things not in the most accurate manner. They can report things to get a highlight or a story. So we have to be very careful with the information that we're allowing to fill our heads. I'm going to tell you that for the most up-to-date and correct information, there are two websites that I use faithfully. That is the CDC website, and that's Johns Hopkins COVID Center. This information is updated continuously throughout the day. I get my statistics, information about medications that we're using to treat patients, and that was one of the questions here, because like the hydroxychloroquine, the Plaquenil, the drug that we're hearing about in the news. We've got the president saying, yeah, use the drug. Well, the president isn't a medical provider. And with all due respect, these are the types of decisions that really need to be made by medical providers, and not the president of the United States, who he's not practicing medicine. He's not in these ICUs. He doesn't understand how this drug works. It's one thing to say it. It's another thing to see what's happening in our community when we use these drugs. So when you fact check things through the CDC, the World Health Organization, you're going to see the most accurate and up-to-date information. And the CDC has done a wonderful job of putting information out for medical providers as well as non-medical providers. They even have an algorithm and a manual for how community members can make surgical or make masks to protect themselves or make masks to deliver to healthcare workers. So this is a comprehensive effort that's being made by our government. So sorry if your cousins, sisters, brothers, uncle sends you a confidential conversation that supposedly happened at the Pentagon. I would say scroll past it.
Thank you.
Are you ready for me to get into some of these questions?
Let's do it.
All right. So I have 20 of them, and in the PowerPoint, there's some links in there that'll bring you to a website that I'm even referring to my own patients. So I'll start with question number 1, which also goes hand in hand with question, I believe, number 17. When it comes to making a mask, is there a certain fabric or material you should use? What type of material should you use as a filter? So the most effective fabrics are going to be water resistant or tightly woven. So you don't want anything that can stretch to allow particles to come through, nothing sheer. So a tightly woven cotton is the next best thing if you can't get a water resistant fabric. You should make the mask with at least 2 layers. I'm not a sewer, but it's essentially like putting 2 pieces of paper together, and you can sew them so that they're dual layered. A lot of people are leaving a space for you to insert something, and a lot of people are wondering what type of filter you can use. The CDC recommends a coffee filter. You can put a coffee filter that slides in between these 2 pieces of fabric to help filter anything that you're breathing in. I don't want people to think that this is like an N95. So my N95 seals to my face. These types of masks are going to help protect you if you're infected and you cough, so your droplets don't come out, and they may help protect you from droplets when others around you cough. What we know is that this virus is transmitted by droplet, but we are taking airborne precautions when we are in close contact with patients because this virus is so virulent. It is easy to spread. One person has the ability to affect up to 14 people at one time with this virus. And if you are not a sewer like myself and you have to go out in public, the CDC says you can use a bandana and also insert a coffee filter and tie that around your face. We're going to recommend that you not use these types of masks for children under the age of 2 or anybody who has issues with breathing with the mask on. So question number 2, what should be used to clean our cars? So I have gone through this with a lot of people. I put in the paper, in my answers, a list of all the store or shelf products that can kill the COVID virus. So they're going to be like your Clorox wipes, your Lysol wipes, germicidal spray, Purell professional disinfectant. The problem is you can't find these in any store. And the CDC has come out with a recommendation to address that. The one thing I have consistently been able to find on the shelf is bleach. Lowe's, Home Depot, you may have to get there early, but I've been able to consistently find that. So if you cannot get Lysol or Clorox wipes or Purell wipes, you can prepare a bleach solution, 5 tablespoons of bleach in a gallon of water, or 4 teaspoons in a quart of water. And those instructions are in the answers. With the bleach, if you have cloth seats, I would be leery about using that to clean your car or any cloth surfaces because it may potentially discolor it. You can also use rubbing alcohol. So a 70% alcohol solution when you're wiping your car down or any hard surfaces. So this is even in the house. You're going to want to let the solution dwell for at least 1 minute. So sometimes I see people wipe something down and because it's wet, they come behind it with a paper towel. The way that this virus is killed, it has to be in contact with this solution for at least a minute for you to really kill off the virus. And I put a source to that as well. The EPA is saying that most household disinfectants, so I know that there's like the bathroom bleach spray, anything that has bleach in it, these are things that are really going to kill the virus. in addition to washing your hands. But your high touch areas, so countertops, keys, I wipe my phone down probably 10 times a day now. You think about how many times you touch your phone after you've touched things. The handles to refrigerators, the microwave door handles to get in and out of your home, door handles to get in and out of your car, your door handles at work. So question 3, should we remove all clothing and have a hot shower every time we go out in public? As a healthcare worker, I do this every time I leave out of the house and come back in if I've gone to work. And at this point, I'm going to say my recommendation is that you do the same. If you go out in public, if you go to a grocery store, I'm going to recommend that you do shower. You wash your, the first thing you should do when you come into your home is wash your hands. Avoid touching your face. If you've been out and you feel like you've been in close contact with people, so a lot of people really don't adhere to social distancing, change your clothes, wash them in hot water, take a shower. I'm finding that a lot of my colleagues are starting to have to wash their hair every day, so I'm wearing a hairnet. But yes, shower, and keep yourself as clean as possible. Question 4, can we go outside to take walks and do gardening? Absolutely. We want you to remain active. We want you to try to be as healthy as possible. So one of the things the state of Maryland, they issued in their stay home statement was, we want you to only go out for essential activities and or to get exercise. So yes, going for a walk is fine. Maintaining social distance. If you want to work in your garden, that's fine. Things that you want to do, most gyms are closed, but you want to avoid gyms. You want to avoid so a lot of places have those outdoor exercise facilities. You want to avoid places where you're going to have to go and touch things. But obviously going for a walk and working in your garden is perfectly fine. When you come back in, we're going to recommend that you wash your hands. If you're out and about and you can wash or sanitize, I'm going to recommend that you do that as well. Question 5. So this one I had a very extended answer to, and I tried to keep it as non-medical as possible. So the question is, will hydroxychloroquine help? How effective is it? So hydroxychloroquine is a drug that we use to treat malaria, and it's also a drug that we use to treat diseases that cause inflammation, so inflammatory diseases. This is a highly debated topic. I know we're hearing about it on the news, and as medical professionals, we are using this drug anecdotally. And anecdotally means based on personal account and not based on medical research, because we've not had enough time to do medical studies on this drug and how it relates to COVID-19. When we look at drugs and their reaction when we're treating a disease, we do randomized control trials, we do systematic reviews, and these are things that take time, years. What I can tell you is the use of hydroxychloroquine in some European countries showed favorable outcomes when persons were either treated prophylactically, so they may have potentially been exposed and they were started on the drug immediately, or at the first sign of a fever, they were started on it immediately. So if you've ever seen the commercials for Tamiflu, oh, this medicine is shown to cut down on how long you have the flu when you take it within the first 72 hours of having symptoms. Well, essentially, this medication is shown to be somewhat effective. We just don't have a lot of research to back that up. So there's really no efficacy rate for the use of hydroxychloroquine with COVID-19. And in fact, the CDC had put out a recommendation for providers to use this drug along with another antibiotic. They have since withdrawn that recommendation because a lot of ICU providers are saying, A, it's not helping, or B, some of the side effects are really bad. So every drug has a side effect. Now, COVID is a virus, and there are antivirals, none of which have been proven to be effective against COVID, but there is one drug, one IV drug, remdesivir, that is being studied now. It's an investigational drug that's given IV, and they're trying to see how this drug is going to work for COVID patients. The way this drug works is it stops the virus from being able to replicate. So a virus gets in and it turns over and grow, it multiplies in numbers. And the thought process is, if this drug can stop the virus from replicating, we're going to cut down the amount of time that it takes for a person to get better. And we're also going to cut down on how many side effects that they see, how sick they get. But again, this is still very much investigational. Question 6. What is the correct protocol for using gloves and masks when going outside for essential purposes? So when you put on your PPE, so the personal protective equipment, your gloves, your goggles, your mask, if you're at home, there's really no regimen for how you should put it on. The most important thing is how you take it off, right? So you're putting it on and you're clean, but then you go out and you come back and you're potentially contaminated. It's going to be important how you remove it. So you can put your PPE on in any manner in your home. So if you're going to put on a mask and you're going to put on a glove and you're going to wear glasses or a shield, when you come home, the most important thing is going to be that you take off your gloves, you take off your gown, you wash your hands. Anytime you're going to remove something from your face, you're going to wash your hands, because we know this is all your respiratory tract. You wash your hands, you take off your mask, you take off your goggles. The very next thing you're going to do, you're going to wash your hands again, because you've just touched a mask that could potentially be contaminated. If you're going to make cloth masks, we recommend that you make more than one, and you wash them in hot water as often as you possibly can. Even if you can wash them in bleach, so you're going to use a fabric that won't become discolored. So question 7, in layman's terms, what is the virus made of, and how does it relate to how it interacts with the body? So COVID-19 is a new strand of a coronavirus that has not been previously seen in humans before. So it's important to understand coronavirus is a group of viruses. And these viruses can cause illnesses as minor as just the common cold, all the way up to as severe as SARS and MERS, what we've seen in the past, and now COVID-19. It is a virus which is it's molecules or RNA that enter the body through the respiratory tract, and it attaches to the cells in the respiratory tract. So this is why we're seeing people who are saying they lost their taste, they lost their smell. A lot of people are really surprised when I tell them your ears, your eyes, your nose, your throat, all of that is connected. When you're congested and you have ear fullness, or you may have a runny eye or runny nose, a sore throat, think about it. All of this is essentially connected behind what we see on the front of our face. So the virus gets into your body and it splits and duplicates. And this is why when you get a cold, you initially just start with maybe a little tickle in your throat, and then the virus splits and duplicates. And the more of the virus you have in your system, the worse you feel. So you start off with mild symptoms, then you get really sick, and then you slowly get better. That's that curve of the virus. So with COVID, it attaches to the cells in the respiratory tract. And for most people, they get mildly ill, like a cold. For our sickest of the sick patients, especially the ones that have lung failure, it's because the virus has caused a severe inflammatory response in the lungs, where the lungs have essentially become full of infection. And then our body comes on top of it and fights it off, or tries to fight it off. And the immune response is to bring white blood cells, or and you get what's called a cytokine storm. You develop just mass inflammation. And a lot of times when we get to the point where you have so much inflammation in your lungs, it's often irreversible. We can't reverse it. And a person cannot live without lungs, so they will ultimately succumb from the COVID. Other things that we see in COVID, because the oxygen levels drop, we see damage to other organs. So we start getting into other organ system failure. Your liver, your kidneys can fail. you can have a brain injury as well. So there are multiple things that happen as a result of having a COVID infection that can cause one to become severely ill. So question 8, this was a good question. Are you no longer contagious on day 15, or should you still take precaution? So the 14-day quarantine is important for anyone who has been exposed, whether you're having symptoms or not. We're talking two different things. So you're going to go into a 14-day quarantine if you've been exposed, and the thought process behind that is if you're going to develop COVID, you're going to start to develop symptoms within that 14 days, but it doesn't necessarily mean on day 15 you're not going to be contagious. What the CDC recommends is that in general, you can return, if you tested positive or you develop symptoms of COVID, you can return to your normal activities after 7 days of first developing symptoms, and you've been 72 hours without having a fever, without having to take Tylenol. So if you've had a fever and you're taking Tylenol to control it, you have to wait 72 hours until you're medication free and 7 days from when you first started developing symptoms before you can come back out into public or come out of self-isolation.
Can you expound on something real quick? You said Tylenol. So can you speak to the NSAIDs, why you shouldn't take that?
Yes. So initially, the recommendation was that you could take any medication known to reduce fever. And now the recommendation is Tylenol only. So if you have liver impairment and you can't take Tylenol, you may have to use alternative ways to get your fever down, room temperature baths, cool cloths, fans. So the NSAIDs, they're a drug that we use to treat inflammation. And there appears to be, and for whatever unknown reason, it appears to have an opposite effect. And it is making the inflammation worse. And that's why we're not recommending that you take NSAIDs. The other thing that they're not recommending is like nebulizer treatments. A lot of the nebulizers have inhaled steroids, so that can have a tendency to make inflammation worse in the setting of a virus. I hope I answered your question with that one. Okay. So the next question was, can you get the virus twice? And the jury is still very much out on this one. It's reasonable to believe that once a person has been infected with a virus, that they're going to develop some type of immunity to it. Most people who get the flu in the same flu season won't get the flu again. But we have to understand that we have different strands of flu. So the experts believe at this point in time that you'll develop some immunity. We don't know how long that immunity is going to be for. And we've had persons who have had COVID continue to test positive for it, though they don't have symptoms. So the recommendation from the CDC is going to be, even if you've tested positive for COVID and you've recovered, that you're still going to follow self-isolation and infection prevention precautions like washing your hands, covering your cough. What happens if a pregnant woman or breastfeeding mother tests positive for the virus? So I've actually had this experience. A colleague of mine tested positive for coronavirus. She was very late in her pregnancy and they had to deliver the baby, and she was essentially due to have her baby. They had to deliver the baby and separate mom from the baby. So we know that children really don't get as sick as most adults do with COVID-19, but it's not worth the risk to introduce this to a baby who has immature lungs and immature organ systems. So one, pregnant women are at higher risk for developing severe illness when they have COVID. One, their body is focusing its attention on developing an entire human, right? So a lot of moms' stores are going to the development of her baby. And they also have a different setup in terms of how they breathe and how they're moving oxygen. So pregnant women are at high risk for developing severe illness. So pregnant women, strict precautions. If you don't have to leave the house, if you can have someone do your grocery shopping, that's what we're going to recommend. A lot of the stores have senior hour for seniors to shop. Those are also going to be the hours that pregnant women should be able to shop. And in the state of Maryland, that's the case. Pregnant women can shop when the seniors shop. If a woman has delivered her baby and she was COVID positive, they're going to be separated until she meets that time where it's been 7 days from first having symptoms or 72 hours from no longer having a fever. If a mom is breastfeeding and she chooses to directly breastfeed without pumping, we're going to recommend that she wear a mask, that she wash her hands, and she wash her body before she takes the baby to breastfeed. If they're non-exclusively breastfeeding, so if they're, or indirectly, they're going to use a breast pump, we're going to recommend that you clean the breast pump and you use a designated breast pump, that you clean your hands before and after, and that you use a mask when you're using the breast pump. And they also recommend having someone else feed the baby if you're pumping, so someone else bottle feed the baby. Question 11. Some people are able to fight the virus at home. At what point should you seek additional care? So if you develop difficulty breathing, that's a call to 911 and an immediate trip to the emergency room. I don't care how mild your difficulty breathing is. If you're having difficulty breathing and you sit down and rest and you can't catch your breath, it's time to go to the hospital. If you have a fever that will not go away when you take Tylenol appropriately, if you can take Tylenol, that's a trip to the hospital. What we know is COVID depletes the body's immune system, so it makes you susceptible to other things. The worst thing we could see is COVID and the flu together, or COVID and another infection, strep throat, or a bacterial pneumonia. So if you have a fever that's not going away, time to seek emergency care. If you're not able to keep down food and fluid for at least 24 hours. So when we get sick, we naturally, most of us tend to lose our appetite. But if you're not able to keep down food or fluid for 24 hours, that's a trip to the emergency room. You should always, always, always contact your medical provider if you have any symptoms to determine the next steps, especially if you have a medical provider that knows you well. And they know your entire medical history. They may make the determination, I know you're not severely ill, but you're going to need to take a trip to the emergency room because you have other issues going on that I'm worried about. Is it necessary? So question 12, is it necessary to remove grocery items from their original packaging? No, but I'm going to recommend that you wash any packages that can be cleaned. So hot soap and water, if it's a package that can be wiped down. What I personally do for items that I cannot wipe down, I place them inside of a clean shopping bag and tie the bag up if I have to refrigerate it or put it in the pantry. And then when I'm ready to use it, I take it out of the shopping bag and then carefully remove it from the package. Question 13, are gloves more harmful than helpful? As a medical provider, one of the things that almost makes me cringe is when I go into a grocery store and I see someone with gloves on, but they're touching stuff and then they touch their face, or they're touching their phone and they're touching stuff. The gloves essentially become pointless at that point. So gloves help to protect your bare hands from coming in contact with contaminated surfaces. But does that mean it's going to stop you from introducing the virus into yourself? No. If you're, say you leave your home and you're in your car is clean, and you go into the grocery store and you don't have access to hand sanitizer or soap and water, when you leave, you essentially want to take those gloves off so that you're getting back into the car with your bare hands. One of the big things that I can't stress enough, I see people do this all the time. They take their gloves off and throw them on the ground. We have to understand that somebody, if that glove is contaminated with COVID, somebody has to come behind you and pick those gloves up. So we run the risk of infecting other people. Just throw them in the trash. So we're seeing abundance of gloves and wipes on the ground. I'm going to recommend that if you wear gloves, that you not touch your phone, or if you do, you wipe it down, that you not touch your face, that you wash your hands, and you wash any high touch areas, steering wheel, keys, phones, things like that. Question 14. How are the COVID-19 cases and deaths reported? Is this something that the CDC is keeping up with, or another organization? So there are multiple organizations that are tracking COVID deaths and infections. as well as recovery. So this includes like your local, your state, your national, and your global organizations. So case in point, I'll give you kind of a rundown of how positive cases reported and why we may have a lag in the amount of COVID cases we actually see. So we may have a 2 to 3 day lag. So a person is tested. So I, as a provider, can order a test, and I send a person to be tested. Their positive test result comes back, and the lab has to report it, and I also have to report it. And usually when they get the patient's name, they marry the two reports. We report that to the local Department of Health. That local Department of Health reports it to the state Department of Health. The state Department of Health then reports it to the CDC. And then the CDC also can report that up to the World Health Organization. So globally, we have a picture of how well the country is doing. So there are multiple organizations that are actually tracking this, most of which get their information from the CDC. Question 15, do we have enough data and research to determine why the infection and mortality rate is lower in children under 18? So I was listening to a lecture by an internal medicine physician, and he talked about certain receptors in children's lungs, and that children tend to they don't have that much of a surface area, a bigger surface area of the lungs, and they also don't make that much mucus, or as much mucus as adults. And because of that, the virus does not have much surface to attach to. The other thought is that children tend to get sick many times throughout the year. I think the average child may get 10 to 12 colds or viruses throughout the year. And for whatever reason, their body is able to respond a lot better to coronavirus. It's not very well understood. What I can tell you is the data is evolving every day, and the current data trends show an extremely low mortality rate for children under 18. So it's less than 1%, and this is globally, not just in the United States, so that's pretty significant. Children are what we consider a protected population, so there will never be any study that's going to be done to introduce the virus. All of the studies are going to be retrospective, meaning they're going to eventually go back, look at all the children that were infected with COVID, and then they're going to look at trends, their history, their vaccinations, and things like that. Question 16, actually question 16 I answered with question 1, is there a preferred method to make homemade masks? And in the questions, there is a link to the CDC on how you can actually make a mask. Question 17, do experts think this will be a seasonal virus like influenza? So the jury is still out on this one. It is very early to determine that. There is a possibility that COVID-19 will come back on a seasonal basis. And every time a virus comes back, it does not come back with the same virulence. So how severe the virus is, or the same characteristics or symptoms. So every time somebody gets the flu, they may initially start out with body aches, but the way the flu affects the body changes from year to year. There are different strains. I hope that COVID-19 does not come back at the magnitude that it's here today. I also hope that by the time next year comes, we'll have a vaccination. So a lot of people get the flu vaccination, and even though we, for the most part, sometimes miss the marker on which strand of the flu to vaccinate against, when you do get the vaccination, a lot of people develop less severe illness. Like their recovery is quicker and their symptoms are not as bad if they've received the flu vaccination. So hopefully there will be a vaccination, but it takes 12 to 18 months to really develop a vaccination for a new illness. And COVID is changing every day. Well, what we know about it is changing every day. Question 18, what charitable organizations do you recommend we consider donations towards that will have an immediate impact to those working in the medical profession? So I posted a link to this, but check with your local health system. So in Maryland, that's MedStar, Johns Hopkins. University of Maryland, they have departments of philanthropy that will accept donations that will directly help these organizations get the equipment that they need. It's very important to understand that these organizations are financially strapped, and they are low on supplies and equipment. And even though they may have the financial means to spend the money to get them, the supplies that the medical providers need is not available. And now we have states kind of bidding for what they need, and we're also bidding against the federal government, which for the most part does not make sense. We are one country. The federal government should be bidding for all of us, but instead leadership is kind of taking a punitive approach because they may not like the way a state has said something, and that's very unfortunate. I will say, and I said this a couple weeks ago, the one bright side of COVID is to see that all of these political parties have put their personal issues aside to come together as a country to fight this. Because if we start to divide now and we start pointing the finger, that can get pretty detrimental. So I mean, we really need to care for our neighbors at this point, whether we have the same political view or not the same. Let's see. So organizations are like the American Nurses Association, local hospital systems, small organizations. So some of the organizations that are going to get hit the hardest with this, and they're usually the most financially disadvantaged, are going to be your hospices. So I live in a county where we have one hospice, that's Hospice of Charles County, and God bless them, and St. Mary's and Calvert County. So reach out to your local hospices. Is there anything that you need? Because they're going to be the ones that are going to be caring for the patients that are not going to survive if they're allowed to come back out to the community. Your local churches, Project Hope, the CDC Foundation, but the best donation of all is compliance and prayer. Be compliant with what we're recommending that you do, and pray for your family, for your loved ones, and for your healthcare workers that are going out every day to deal with this. Question 19. So we got one more question after this. If you start feeling ill, coughing, chest tightness, what are some preventive measures that can be done at home? So self-quarantine and isolation, that's number one. If you live alone, we're going to recommend that you stay home. If you live in a home with other people, we're going to recommend that you isolate yourself to a different part of the house. Clean high-touch areas and surfaces, washing your hands often, staying hydrated, treating your fever and aches with Tylenol if you can take that, and deep breathing exercises. So you can YouTube deep breathing exercises. We want you taking deep breaths. You have little pockets in your lungs, and we know that this virus has a tendency to collapse those pockets. So we want you practicing deep breathing exercises to keep those pockets open, to keep your lungs as healthy as possible. So if you start feeling chest tightness or cough, I really encourage you to do those deep breathing exercises. Eating nutritious foods. So I would steer clear of things very high in sugar. We know that viruses and bacteria, they like sugar. And that's why when diabetics get infections and their diabetes is not very well controlled, it's really hard to treat those infections because they have a high level of glucose in their bloodstream. So you're going to eat things that are nutritious. I always say things on the rainbow, colorful things high in vitamins, high in nutrients. Prayer, remain hopeful. I said this to a patient the other day after she had the opportunity to meet with ministry staff. There was no amount of medication. There was no pill that I could give this patient that was going to be better for her than what she received from her minister. She did so much better. Her faith was restored. She was re-energized to fight what she had going on. And that is so important. You have to have a positive outlook, even in the darkest hour. That's faith, right? You have this blind faith. I know that God's going to deliver me through this. You pull on your other resources. That's very important, and that's better than any medication I could ever prescribe for you. And contacting your medical provider. You have to have a lines of communication open, because if you start to feel ill and you call and they know, well, this is one of my patients that was not feeling ill, they're going to have that line open and be ready to instruct you on what to do next. Question 20, distinguish, so what are the distinguishing symptoms different, or distinguish the symptoms different from a cold versus a flu versus allergies, asthma, and COVID-19? So I attached a chart from the Kansas City Department of Health. And this is a really good explanation. So with COVID, one of the common symptoms with COVID are going to be a dry cough, a fever, shortness of breath, but that's really when you're starting to have some severe issues, and exhaustion, right? And we're starting to see other symptoms that are coming up, like loss of taste and smell, some GI issues, headache, nausea, things that are rare that are really common in these other illnesses are like a runny nose. It's rare to have a runny nose with COVID-19, but it's common to have a runny nose with the cold, and common to have it with the flu. Also with the flu, you get body aches, you get headache, you can get a sore throat. You're not really going to see, we don't really see sore throats with COVID-19. And for asthmatics, you kind of know, most asthmatics know when it's an asthma related issue. However, I'm going to caution you to say, if you have asthma, you are high risk for developing severe illness with COVID. So pay attention to your body, right? So we had a group of people who were paying attention to their body and said, why can't I smell or taste anything? And they got tested for COVID, and now we know that that's a symptom. So this is very much evolving. If you take a look at the chart that I've sent you, this can kind of help you understand whether or not you're dealing with cold, flu, allergies. About 2 weeks ago, I just felt horrible. I had sinus pressure, and I was like, oh, please don't tell me I have COVID. And then my 6-year-old comes in the room scratching his eyes, and my husband's clearing his throat. And then I look outside, and my car is covered in pollen. So I knew it was allergies, right? Allergies is usually triggered by something. But you know your body, and if you ever have any questions or concerns, that's when we recommend that you reach out to a medical professional who, we have special questions or specific questions that we ask to really know and determine what we're looking at. And that was the last question.
Thank you so much. You have been such a blessing to us tonight. And I know that was probably kind of hard for you, going almost a straight hour talking, but you've blessed us, and I think we can move a little forward. You answered a lot of questions for us. Some of us were very skillful, fearful, we were scared. There was a lot of questions we had, but you have made it better tonight, and so we are grateful. And so, and I know there are probably going to be some more changes you're going to come across as you keep dealing with COVID-19, and maybe we can bring you back again with some of the new changes that may occur. But again, we appreciate you taking your time after working sometimes 14 to 16 hours a day. Then you got to rest. Then you got to come back, and you got to have some time to deal with your family. And then you got to just at least try to unwind mentally based on everything that you've seen on a daily basis. So for you to say yes to us, we appreciate it from the bottom of our hearts. And so New Life, if you can hear me, I want all of you to let Rachel know how much you appreciate her by saying thank you in the chat box. Hopefully she can see it.
I can. Yeah.
Okay. And as I said to you, you have put in the time to study. You are very well versed. You didn't have to open up no books and turn pages. I commend you for a job well done. And if any of us had to be in the hospital, we would want somebody like you because you're good at what you do. So we just want you to know that we are thankful for you, And so New Life, our family is saying thank you from the very depths of our heart. And I want you to know when this is all over, and maybe when we go back to the building, I want to give you a special invitation to come so you can meet us all face to face, and we get a chance to really, really let you know how much we appreciate you. So thank you again. Is everybody put in that thank you?
Yes.
Okay. All right.
It was definitely my pleasure. This is certainly my gift. As many times as I say I want to walk away from medicine, I joke and say my next profession, I'm going to be a meteorologist. I'm going to tell the weather. God finds another way to show me that this is exactly where I need to be.
This is definitely your calling. This is definitely your calling. And we want you to know that we're going to be praying for you and your family, your coworkers. And if there's anything that we can do, if something comes up, any special prayer concerns, you got my information. You can shoot it to me. But just know we appreciate you. We're praying for you. And we bid you Godspeed.
Thank you. Thank you very much.
Bishop, we have one more question. Can you hear me?
Yes.
We have one more question. So, so for those that are asymptomatic and aren't carrying the symptoms, but they're carrying the virus, can you develop it later on? Is that a possibility?
So if you're asymptomatic, but you're COVID positive, right? So that that is a very unique group of individuals that can carry this virus and not be symptomatic. And it would just so happen to be that you incidentally were tested, right? Because maybe you were exposed to someone and you never developed the symptoms. From the time that you're tested, the recommendation is from the time that you have that positive result, you're going to wait 7 days before you reintroduce yourself into public. So most of these patients that are asymptomatic but being tested, they're being tested because they were exposed to someone, or they were exposed and the health department contacted them. We really don't understand why some of these people who test positive never develop symptoms. Like the pregnant colleague who tested positive, she never developed symptoms, but she tested positive. It's also important to understand that we rushed a lot of these tests and a lot of these labs to run these tests. So we have a very, very, very high false negative rate. So, it's a double-edged sword. We have people who are tested and everything that we're looking at says that this person is COVID positive, but my test is negative. And that's what happens when we rush medicine to develop something. We don't have the adequate time to do it. And it's the same with our patients that test positive. It could be a false positive, but we can't take that chance and say, oh, this is a false positive. So we recommend that from the time you have your positive result that you not go out for 7 days, or if you develop symptoms, you're going to wait until you're fever free for 72 hours.
One last question, I promise.
Sure.
Last one. One member asked a question. I have asthma. Should I be going to work at all rather than quarantine for 14 days? She says, I'm a teacher moving from class to class in the halls of students from 8 to 3, 8 in the morning to 3 in the afternoon.
So most of the school systems up here have closed down, and we've moved to virtual classrooms. If your asthma, if you were my patient and I know that you have poorly controlled asthma, I'm going to write you out of work. I'm going to say that you need an accommodation, and your accommodation may be that the way that you're going to teach is that the students are going to come to a classroom and you're going to be on a screen, because you are one of those patients that if you have poorly controlled asthma and you develop COVID, you most likely will develop severe illness, or you're at high risk for developing it. So I'm going to encourage you to do a couple things. Talk with your medical provider, because they know you best. And if they feel that your asthma has the potential to be poorly controlled, they may potentially either write you out on short-term disability, because that's what we've had to do with a lot of our pregnant patients, or they can request that you have an accommodation to have be set up with virtual teaching. So they'll set you up with a Zoom, and your students will come in and you teach them through a screen. If you're relatively healthy and you have asthma that's relatively well controlled, that's going to be a determination your doctor is going to have to make to send you into that environment. Even though you're working with children, this is an equal opportunity virus. Anybody is susceptible to it.
Okay. All right. Thank you. That's going to end it. I want everybody to know that's on tonight. We're going to send this link to you so you can replay it. You can send it to your friends. You can send it to your loved ones. We wanted to go. We're going to put it on Facebook after we get finished. And we're going to get you to send it out to as many friends, as family members as you can, because this is valuable information. This is, to me, this is just like gold. This could have the potential to save your life. And so take advantage of it. All you had to do was sit and listen. So all you have to do now is just send a link out. Our administrator, Tiara, will send this out so everybody will have an opportunity to send it. So again, thank you, Rachel. And I'll be talking to you shortly after we get off of this video. Okay. So thank you, New Life family and friends, far and near, for coming and being a part of this COVID-19 workshop tonight. And God bless you all. Stay safe, listen to and take all of the directions. And remember, it's not only you, but it's those who are around you as well. So God bless you. Have a good night. And we love you in Jesus' name.
Thank you.
Thank you.